Raise your hand if you've ever had a baby yourself, have a partner who has had a baby, or even have known someone that's had a baby. Did any one of you, your partner, or your friends experience severe morning sickness, other words known as vomiting and nausea during pregnancy? According to the National Organization for Rare Disorders, 0.5 to 2% of pregnant women will experience hyperemesis gravidarum throughout their pregnancy. Chances are that you know someone, or even you yourself, have had to experience this rare disorder. And if you're thinking to yourself, I definitely don't know anybody that's had to experience this rare disorder, now you do. My name is Aaliyah Boggs, and I was a victim of hyperemesis gravidarum. Today, I'm going to be talking about why people get hyperemesis gravidarum, the effects of hyperemesis gravidarum, and ways to help lessen these severe effects. Hyperemesis gravidarum, also known as HG, affects 0.5 to 2% of pregnant women. It is a rare disorder, and it comes with nausea and vomiting during pregnancy, and in severe cases results in hospitalization. If you can't get a clear picture about how severe hyperemesis gravidarum is, during my first pregnancy, I vomited approximately 150 to 200 times per day. I was hospitalized approximately 30 times, and I lost 25 to 30 pounds within my first trimester. Cleveland Clinic tells us that HG might be caused by a rapid rate in hormone production within the pregnancy hormone, also known as HCG, and estrogen. Although the clear known cause is still not known today. Now that you know what HG is, let me convey to you the effects of hyperemesis gravidarum. Some common symptoms of hyperemesis gravidarum are nausea, vomiting, which we covered both of those already, losing 5 to 10% of your total body weight, dizziness, fatigue, and dehydration. Other effects could be rapid heart rate, an increase in salivation, and the loss of teeth. During my pregnancy, I had something called pregnancy tachycardia. This is when your heart goes fast. During my resting heart rate, it would be 180 beats per minute. This was because of hyperemesis gravidarum. I had strip throat lining, which caused me to throw up blood, and I lost 2 teeth. My back 2 wisdom teeth completely lost enamel because of me throwing up stomach acid constantly. Some long-term effects that the HER Foundation lists are socioeconomic changes, such as one losing one's job, attitude changes towards future pregnancies, such as not wanting any more kids because not wanting to deal with hyperemesis gravidarum again, or being completely petrified to have any more children because they're scared to go through that again, and also depression and anxiety. Unfortunately, the HER Foundation also tells us that 34% of pregnant women will indeed lose their baby if they were diagnosed with hyperemesis gravidarum. Now that I've explained the effects of hyperemesis gravidarum, I will tell you ways that you can lessen the severity of these symptoms. This is my medication that I had to take on a regular, so I'm going to start off with medication. The first one is Zofran. Zofran helps with nausea. Then you have Phenergan, which helps with nausea, but at nighttime as it makes you extremely drowsy. You have B6, which is a vitamin that can combat nausea. You have Unisom, but it's not Unisom itself that helps nausea. It's actually the side effect of Unisom, which gives you help with your nausea. And then Pepcid for reflux. Small snacks can also help just so that you're retaining nutrients, such as ice, not very much there, bland salads, bland soups, saltine crackers, and graham crackers, also ginger candies, lots of fluids such as water, or fluids that are high in electrolytes, such as Powerade, Pedialyte, and Pedialyte ice pops. In severe cases, pregnant women will need to get hospitalized as they will be dehydrated from throwing up constantly, and IV can help get medication into their system and also help hydrate them. Now that you know some treatments for HG, I will finish with my conclusion. Hyperemesis gravidarum is a rare disorder that affects 0.5 to 2% of pregnant women, caused by a rapid rate in hormone production. Hyperemesis gravidarum affects a variety of women in a variety of different ways, but the most common is nausea and vomiting. Hyperemesis gravidum has a wide variety of ways to help lessen the severity of the effects, but the most common that you will receive is medication, small snacks, fluids, and in severe cases, hospitalization. Thank you.